Lungs. Each lung is conical in shape, an apex at the upper end, a base resting on the diaphragm. There are three borders, anterior, posterior and the inferior, two surfaces, costal and medial. The medial surface is divided into vertebral and mediastinal parts. This is the apex of the lungs. These are the base of the lungs that rest on the diaphragm. These are the anterior border of the lungs. These are the posterior border of the lungs. This is the inferior border of the lungs. Two surfaces, the costal surface and the medial surface. Medial surface is divided into mediastinal surface and the vertebral surface. Apex is blunt. It is covered by the cervical pleura and the suprapleural membrane. To get the information about the pleura and the types of pleura, go to my channel's playlist of thorax. The base is semilunar and concave. It rests on the diaphragm which separates the lungs from the stomach. The anterior border is very thin. It is shorter than the posterior border. The left lung shows a wide cardiac notch below the level of the fourth costal cartilage. This is the cervical pleura, which covers the apex of the lungs. As you can see, the base of the lungs rests on the diaphragm and the diaphragm separates the lungs from the stomach. Here is the fourth costal cartilage and here is the cardiac notch of the left lung. The posterior border is thick and ill-defined. It extends from the level of the 7th cervical spine to the 10th thoracic spine. The inferior border separates the base from the costal and the medial surface. The costal surface is large and convex. The medial surface is divided into posterior or vertebral part and an anterior or mediastinal part. Fissures and the lobes of the lungs. The right lung is divided into three lobes, upper, middle and lower, by the two fissures, oblique and horizontal. The left lung is divided into two lobes by the oblique fissure. As you can see in this diagram, the right lung has the three lobes, superior, middle and inferior, and the left lung has superior and inferior lobe. The right lung has two fissures, horizontal and oblique. The left lung has oblique fissure. The oblique fissure cuts into the whole thickness of the lung except at the hilum. In the right lung, the horizontal fissure passes from the anterior border up to the oblique fissure and separates a wedge-shaped middle lobe from the upper lobe. Tongue-shaped projection of the left lung below the cardiac notch is called as the lingula. This is the lingula. Root of the lung. The root of the lung is a short, broad pedicle which connects the medial surface of the lung to the mediastinum. It is formed by the structures which either enters or come out of the lung at the hilum. Content. The root is made up of the following structures: principal bronchus on the left side and eparterial and hyparterial bronchi on the right side in the posterior part. One pulmonary artery in the middle part. Two pulmonary veins, superior and inferior in the anterior part. Bronchial arteries, one on the right side and two on the left side. Bronchial veins, anterior and posterior pulmonary plexus of the nerves. Lymphatics of the lung. Bronchopulmonary lymph nodes and the areolar tissue. Relations of the root. Anterior phrenic nerve, pericardiacophrenic vessels, anterior pulmonary plexus. On the side, superior vena cava and a part of the right atrium. Posterior vagus nerve and posterior pulmonary plexus. On the side, descending thoracic aorta. Superior, on the right side, terminal part of the azygous vein. On the left side, arch of aorta. Inferior, pulmonary ligament. The right lung. The right lung is shorter and broader. It is larger and heavier. Anterior border is straight. Cardiac impression is shallow or absent. Absence of the lingula. It has two fissures and three lobes. The left lung is longer and narrow. It is smaller and lighter. Anterior border is interrupted by the cardiac notch. Cardiac impression is deep. Lingula is present. It has only one fissure and two lobes.